going to an infertility specialist is a big taboo in the mind of all the couples. They feel that they should go to an infertility specialist when they have already tried for say ages and they have shown n number of doctors, then they seek the help of an infertility specialist, because in their mind they feel that going to an infertility specialist means their IVF will be done. That is not the truth. So it is a myth in the patient's mind. Why you should see an infertility specialist? Because the infertility specialist will at least make a diagnosis out of you that what is the problem in your body. So why the fertility organs are not working properly, why you are not conceiving. So is there any problem like the fertility organs are not working properly, or is there some problem with your blood, or there is some anatomical defect that you need to undergo any procedure, like any medications also you might need, any surgery also you might need, IVF also you might need, or the specialist may also tell you that look, you don't need anything, this you have to follow and you might be able to conceive within 1 year. So just chill out and go home and take rest and try properly. So these are all the options that can happen to you. But what happens when you give yourself a trial for a long time without seeking any proper help? If you're not seeking any proper guidance, you are taking trials like you are taking medications for a long time, because basically you don't know what medication you are taking, what your body is requiring. You are not talking to your body. Talking to your body is very essential. It's not like you are going to speak to your body, but you should know what is the problem with your body. Like if you have got a child at home and the child is not performing, definitely you need to first and foremost address and talk to the child that what is the problem of the child. So the same you need to do with your body. So first and foremost, we need to check your ovaries, we need to check your fallopian tubes, we need to check your uterus, and to come to a diagnosis, plus the male counterpart, come to a diagnosis that what is the problem with you. And then what is the problem and what needs to be given to you to address those issues, so that you just stop having those problems, or you need to be supplemented with those. So it's very essential for you to see a IVF specialist prior to any treatment you are taking for the infertility purposes. Secondly, patients come to us who have already taken medications for ovulation induction for say around 24 cycles, and that is not indicated. The guidelines also say that you cannot have these medications for more than 12 cycles in your whole lifetime. And patients have been seeing us who have been taking ovulation induction drugs for say ages. They say that they have their periods, they take these medications to make their eggs, and then they try to conceive. So please just don't do that. Don't have blind practices. The tubes are not checked. Patients have been induced. They have had IUIs. That is also a big you should not do this with your body. So you need to check yourself, you need to talk to your body, and then only you need to take the medications. Patients go for laparoscopic surgeries, their endometritic cysts, the ovarian tissue is removed, and the egg freezing hasn't been done. So ultimately the patient lands for an IVF cycle, that too with don't reg. So just don't do it. First and foremost, seek any infertility specialist help, so that you will be guided properly and step by step guidance will be given. Because they know, because when we take out the eggs in the lab, we take out the sperms in the lab, we know we want to make embryos, that time we know what problems we are facing.